And for the men in our audience and the women who love them, discover the male fountain of youth. Everything from plastic surgery to testosterone boosters. It could give your sex life a big change. Talking about that male fountain of youth. Who has time to exercise? Who wants to diet? Well, certainly not me, even though I try very hard. There's a more drastic and permanent solution. Have those ugly pounds just sucked right out of you? Yeah, I'm talking about liposuction. It's becoming the fastest way to deflate that big spare tire that a lot of guys are, hanging around with. And apparently, it is quite the operation. I guess this is an operation of choice now for men across the country. Joining me now to tell us all about the pros and cons of liposuction is someone who performs it every single day, Dr. Darrick Antell. Good to see you.
Thank you. Thank you very much for having me. Also
with us now is Nancy Friday, a best-selling author who writes on the male-female thing all the time. Her latest book is The Power of Beauty, and it devotes an entire chapter to men and their vanity. Nancy, good to see you.
Thank you.
Let's talk to you just a second here. What's going on here? It seems more prevalent than ever. $10 billion, I think, spent last year on cosmetics and surgeries for men. What are we doing?
Not to mention fashion and everything else.
Yeah.
It's been going steadily up, up, up. My feeling is that a lot of it is due to the fact that in the old days, when the patriarchal deal used to work 25, 30 years ago, you all had the money.
Yeah.
We had the beauty. That was the deal. The powerful man who had a lot of money got the most beautiful woman. We all sort of understood that. Then when women got into the workplace, your power turf, I think men's sort of natural reaction, it wasn't thought out, was, okay, girls, if you're going to take some of our power, we'll move back into beauty, because it did used to belong to men. A couple hundred years ago, as the good doctor knows, I'm sure, you people were the ones in tights.
Yeah.
You were the ones whose genitals were proudly wrapped and who wore long, pointy shoes to suggest that your penis was as long as your pointy shoes and your armor.
Yeah.
Yeah,
who's to say my genitals aren't wrapped right now, as a matter of fact, before every show. So we want to take some of your turf back. We want the beauty turf.
Well, I think there's a natural balance between the sexes that we try to get along, as it were, that there's some kind of arrangement between us. And I also think it's wonderful that men are getting into looks, because I think not only is it good for you all to be looked at and to enjoy looking at yourself, but I think it's also going to be good for women to have men getting into the mirror alongside us. There's a section in my book which I call Get Out of My Mirror, where I envision this couple getting up in the morning, and she's used to having the mirror to herself, and there's this guy over there who keeps moosing his hair and moosing his hair, and it's going to make women think twice about saying, oh, who me beautiful. Now maybe because he's into it too, when people compliment her, she'll get into and understand what she has and enjoy it, I hope.
Yeah. Let's talk about plastic surgery now, as you sit here with us. Doctor, eyes #1 for guys right now or not?
Yes, that's absolutely right, Mike. I think that I agree with what Nancy said, but I also think that a lot of it comes down to sex. It's sexual attractiveness. You have a very nice suit on and a nice tie, and you want to look good all the time, not only for your own self-feelings, but also for the feelings of other people, to attract other people, I think.
Okay.
Eyes are certainly one of the most popular operations, though.
Let's throw up a set of eyes here and see if this is the before or after. Brendan, why don't you go ahead and pop those up there. Apparently, this is the before, I'm hoping. Now, what will be done here?
This is a patient that actually had his forehead worked on as well. There's some bumpy areas on his forehead just above the eyebrows that were removed with the surgery. So it was to lift his eyebrows. It wasn't so much just eyes themselves. It was really more the forehead.
Yeah. Well, no, what about down below to get rid of the bags?
There's some very good operations for that. In fact, I've had my eyelids operated on. I just got sick of people,
zooming real tight on your face.
I just got sick of people telling me that I looked tired. And that was about 14 years ago. And I was very happy that I did it. At the time, I was dating my wife. We weren't married yet. And I didn't tell her about it. I went on a vacation, came back about 2 weeks later, and told her a few days after I came back. Yeah. And she said, I thought your eyes just looked brighter because you were on vacation when you got off the plane.
Now, what about the lids up here? Is it, and any type of eye surgery, how long would it take? Could I go in on, like, tomorrow and be back here on Monday or Tuesday and nobody would know where I was?
No, that'd be a little bit misleading. In general, I tell my patients that they should figure that it's about a week to 10 days for bruising to go away. There may still be a little bruising, It depends partly how well you heal and how much you keep ice on the area afterwards. Ice is very important to chill it to minimize any bruising and swelling.
Well, if I have it done, I'll just say I got into a fight with our producer, Judy Bishop. She slaps him around all the time anyway, so they would understand it. Now, we're talking about lasers here, or actually cutting.
Well, a laser is simply a tool, and a laser is one way to operate on the eyelid. You can use the laser to either make an incision to access the fat, which is what causes the puffiness, or you can use it to sort of buff up the skin on the bottom lid.
Okay, let's go into some bellies here. I guess, would bellies be number two? Guys constantly worry about their bellies, all these ab roller commercials you just see. The country is obsessed with the ab rollers and our abdominals.
Well, bellies are certainly right up there, but they're actually number three. Nasal surgery would be second.
Oh, really?
Then down to liposuction.
Look at that belly there. Now, you got your big belly there on the left. I don't know if you can see that, doctor. And then,
yes, I do.
This was one of your patients?
Yes, it was.
Okay, now what'd you do?
Well, this man had liposuction on his tummy. There are access incisions in the belly button and in the pubic hair area, so they're really not visible. The surgery is generally done on an outpatient basis where people go home afterwards and wear an elastic wrap to keep pressure on the area and minimize swelling.
Side effects and people having blood run down into their testicles and all sorts of horrible things, and they take tissue out at the same time. But this procedure's been done for years now.
Yes, it has. And the techniques are always improving. We now use something called the tumescent technique, which has minimized bruising going and tracking down into the testicle area. But I think that one of the real improvements of liposuction is sometimes the motivation that it gives people to go on and continue to diet more, exercise more, and generally improve their self-image. Yeah. Sometimes people will come in looking down at the floor at the early appointments for the consultation, and by the end, they have their chin up and they're looking straight ahead.
Okay. When we come back, I do want to touch on actually breast reduction for men. Men in their 40s and 50s actually kind of start to worry about that, and maybe some chin work, too. We'll try to cover as much as we can. Also, remember the Carly Simon song, You're So Vain? Well, she wrote it all about, well, us guys now who are baby boomers. We'll talk about being so vain in our 40s and 50s. Coming right back.